Hello, my name is Nicole. This video will be looking at the Sulcus, Apprehension, and Relocation tests. For some of the demonstrations, I will include my husband, Mitch. Here he is. Wave, Mitch. For some of these tests. Hope you enjoy. So you'll be performing this test if your patient comes in with any complaints of one shoulder instability. These are tests for the glenohumeral or the shoulder joint instability. The sulcus is looking at the inferior instability, while the apprehension and the relocation is looking at anterior instability. The shoulder is one of the most mobile joints in the body, and as you can tell by the diagram, it does rely on a lot of the soft tissue for support, the rotator cuff being the most important kind of soft tissue that helps center the humeral head into the socket and counteracting any forces that it takes. The leading cause to instability on a patient is trauma. And so instability is going to present like fear of it being displaced or pain or decreased range of motion. So when should you perform these tests? You'd be performing this if a patient comes in with complaints of a shoulder pain or instability without recent trauma. You wouldn't want to do it with recent trauma. Or if the patient has a history of previous subluxations or having this feeling of instability, and then especially if this patient is here for a sports physical, you want to make sure you're examining the instability of the shoulder, especially for upper body sports like baseball, volleyball, and football and such. There is a really high rate of recurrent dislocation in youth for anterior shoulder dislocation, so really keeping a close eye on these kids and making sure that they have a referral to PT or surgical referral as well if it's a recurrent issue. And then when you're looking at these injuries, making sure that you understand like the mechanism of when it happens, what direction it is, how severe it was, and then how often it's happened. So in this video, I'll be demonstrating the sulcus test. At first, you're going to make sure that you can visualize the entire shoulder joint on both sides. And you're going to start by just looking at both shoulders to look for symmetry. You're going to start on the unaffected side. You're going to take one hand, so your non-dominant hand, on the distal humerus. And you're going to put your thumb on your dominant hand underneath the acromion. You're going to slowly pull downward. Hold on. You're going to slowly pull downward, looking and feeling for a gapping under the acromion. If that gap is above 2 centimeters or about thumb size, then it would be a positive test for inferior instability. In this video, I'll be demonstrating the apprehension test. In the setting of a positive apprehension test, then you can go straight into the relocation test. So I will be performing that at the end. For the apprehension test, you will instruct your patient to lie in a supine position, and you will have them abduct their shoulder into a 90-degree angle. You'll instruct your patient to voice any fear of subluxation or dislocation throughout the test. You'll stabilize their shoulder with one hand while externally rotating the humerus while looking for any apprehension in their face or listening for any voice of pain or fear of subluxation. If they do have a fear of subluxation or pain, that would indicate a positive apprehension test. At that point, you can go straight into the relocation test, which would be by applying pressure in anterior to posterior pressure into the humeral head. So you're applying downward pressure, and if that pressure alleviates the pain, that would indicate a positive relocation test. If it does not alleviate the pain, then you would consider more of an impingement into your differentials at that point.